carpal tunnel syndrome. What is this? People have heard about it, people are suffering from it, but maybe you have an idea what it is, but I thought I'll just give you a brief explanation as to what is carpal tunnel, how do we diagnose carpal tunnel, can we prevent carpal tunnel, and what do we need to treat carpal tunnel. So carpal tunnel is generally the condition which you get when your median nerve, which is one of the nerves which is supplying the muscles and the skin, the sensation in your hand, gets compressed between a tough tissue and the carpal bones at your wrist. So the compression happens at the wrist, and it generally affects the medial 3.5 fingers. So this finger, this one, and half of this finger, the sensation is supplied by that nerve and some of the intrinsic muscles of the hand, especially the thenae minors, these muscles here. So if it gets compressed for a long time, it might start with just a tingling sensation in your fingers. It might be that you have a lot of pain in your fingers, and then it might even lead to weakness of these muscles. So gripping things, writing, and maybe holding on to things becomes more difficult. And this pain can even radiate along the arm all the way up to your neck. So it doesn't necessarily stay in the hand alone. This pain can go all the way up your neck. And also generally patients say it is worse at night, and they sometimes have to hang the hand down to get some relief. So this is essentially a clinical diagnosis. So by listening to your story and examining you, we can fairly degree of certainty say that this is carpal tunnel syndrome, and then we take the next steps to confirm that this is so. So examination, there are certain things which you do. The doctor might tap at your wrist. This might cause a shooting pain in the distribution of the nerve. And the next thing that they generally would ask you to do is a nerve conduction study and an EMG. So this is generally done by a consultant electrophysiologist, and this person would use a machine to check whether the conduction of the nerve is normal, and by this he may be able to say at what level the nerve is getting compressed and how much it is getting compressed, whether it is mild, whether it is moderate, or whether it is severe. The next thing is the EMG, which would check the activity of the muscle to see how badly these muscles are affected. So then we generally get the report back saying that this person is suffering from carpal tunnel syndrome, and whether this is mild, moderate, or severe. Now depending on whether the severity, the management would differ. Now if it is only mild, symptoms are mild, then maybe we can manage it with some medication to reduce the pain and reduce the symptoms, and maybe some exercises and all to increase the gliding effect of the nerve, and thereby reducing the carpal tunnel syndrome and its progression. We would also like to check whether this person is having any deficiency in thyroid hormones and all, because that may also be one of the causes. We may even be able to do some lifestyle modifications, way in which you bend your wrists when you are using the computer, or the activity that you may be doing may be affecting this, and by maybe changing these slightly, we might be able to control the milder cases. But if you're having moderate to severe or severe carpal tunnel syndrome, generally surgery is the treatment, the accepted treatment. People come and ask me whether they can get injections and whether they can do other things. I mean, yes, some people do try injections, but you generally only get very temporary relief. So therefore, the one which give you permanent relief is called a carpal tunnel decompression. So basically what we do is we release that tough tissue so that the nerve doesn't get compressed anymore. And if this is done correctly, then your symptoms would go away, and depending on the severity, over time and with physiotherapy, your strength and your activity of the fingers would return back to normal.